And now I'm very happy to introduce this further session presentation about adults' conceptualization and enactments of child protection in schools in a challenging context. And our speakers are Sister Anna Teresa Nyadombo. She's a sister from the congregation of the Sister of the Handmaids of Our Lady of Mount Carmel, working at the Zimbabwe Catholic Bishops' Conference as National Education and Safeguarding Coordinator. She is a council member of Catholic University of Zimbabwe and was appointed by Pope Francis in 2022 to be a member of the Pontifical Commission on Protection of Minors. Here we have another case, a very long CV, a very long list of titles, so just let me mention some of them. Sister Nyadombo studied in several disciplines, including education, canon law, social sciences, international leadership. She has a Doctor of Philosophy in Education and Social Sciences from the University of Dublin in Ireland. And in Zimbabwe, as national coordinator, she promotes different approaches, creating safe environments to safeguarding of minors and vulnerable adults. So we are looking forward to listening your presentation, which will be shared with Karen De Vries, Professor of Social Epidemiology. And she has expertise in the prevention of violence against children and adolescents and child protection. She leads the Child Protection Research Group, and she's affiliated with the Gender Violence and Health Center, the Center for Evidence in Disability, the Center for Evaluation, and the Center for Global Mental Health. So, we are happy to welcome you here and really happy to give it over to you. Thank you. So, Sister Nyadombo.
Good morning, my friends in safeguarding. Allow me to begin the presentation. Well, in my mind, I know that I am supposed to observe all the leadership we have here. I acknowledge your presence, and also we thank you for inviting us to be here. I welcome you to Zimbabwe. Just to give you a brief background about Zimbabwe, where I am coming from. I am coming from the Bishops' Conference, where I am the head of the Education Commission and the safeguarding program rests with the Education Commission. In Zimbabwe, we have 12 commissions. And also, we work with the universities, colleges, primary schools, and secondary schools. Our mandate is also to work with every diocese in the country, especially in education and safeguarding of minors. We are also working with vulnerable adults in the process of safeguarding. Our main thrust as a commission, we are supposed to promote inclusive learning and holistic approach to education, where we address all the needs of the child, socially, intellectually, physical, emotional, and spiritual. Together with the Ministry of Education, we work together to promote a sound and inclusive curriculum. We also promote education in the Catholic ethos for evangelization. Our focus on safeguarding program started in the year 2015. where the bishops endorsed the first policy. And in that policy, we were tasked to move and prepare all people to be aware of the existing policy on child protection in the country. So our role was to unpack what was in the policy, to understand the scope of the policy, to help people understand policy and procedures. Also to help people understand what we call the 5 R's: how to recognize, respond, record, refer, and review cases. Then from 2016 to 2018, our main task was to work with religious. Here we also included the bishops, priests, brothers and sisters, and the lay leaders in the church, in the Catholic institutions. But from our workshops, we noticed that we are leaving another group of people. These were school children. Hence, in 2019, we had a pilot study in the Archdiocese of Bulawayo, where we selected 200 students, both boys and girls. We went through the program with them, and the students were able to identify the gaps which were there in their learning environment. That led us to come out with what we call School Micro Model. School Micro Model was inviting schools to be aware that it is necessary when you are dealing with school children that children themselves are involved in decision making. Therefore, we created also and trained them to have child-led committees. Parents were supposed to be involved because students are in school in the morning and in the evening they are with parents. So parents should know what is happening in the school and also to help the students themselves with their aims. Then this led to the involvement of all who are participating in the school environment, the school management, also the religious component, and also all children, that they will be aware of their rights and their responsibilities. This led to the Zimbabwe Catholic Bishops' Conference to come out with a policy to focus on unity in diversity in school environments, where peace was supposed to be the core, love and safety for children and vulnerable adults. With that, with the research which the children had done in pilot, we discovered that there were indicators which needed special attention: bullying, children to children, child to child, sometimes we called it peer to peer. There was also bullying among adults to children. Those who were working with children could be the ancillary staff or the teachers. There was the issue of violence, which was highlighted by the students. There was also the issue of corporal punishment before the government brought out the Education Act of 2020. Then there was also a lot of abuses happening in the schools. Different names of abuses were there. We will name them afterwards. This led the Commission to develop manuals to address the indicators which were highlighted by the students. We had manuals for learners, and we focused on grade 4, 5, and 6. We had manuals for teachers, which was going to be guiding teachers, but at the same time, working together also with the learners' manual. We had also the manual for school management to help the school management to improve the safe environment for children in the schools. We had a religious manual, which was helping religious to understand their role in schools and also in safeguarding. Also, we had the manual, which we called Positive Parenting Manual for parents, so that the parents would understand what is happening in the schools. From that, we had training workshops. We trained education secretaries at ISN level and also safeguarding officers for them to be trainer of trainers. We also trained school management, local responsible authorities, school development committees, boards of parents, and also deputy heads and teachers. We trained the teachers separately so that the teachers will help to establish adult-led committees and also child-led committees. We trained learners to know different types of abuse. From the pilot which we had, we selected 30 minutes, which were granted by the Minister of Primary and Secondary Education, as lessons to be taught in our schools, in primary schools. And that helped teachers to have a bond with children. We are testing on the relationship between the teacher and the learner. We also trained the teachers not only to teach safeguarding, but to allow students to reflect on what they are doing, because we were emphasizing on change of character and attitudes. Parents were trained for their positive manual, and that positive manual was linking with the topics in the teacher's manual, the student manual, and what parents are expected to do to promote good, non-violent discipline at home. And then the school management were trained to improve their approaches to their management and accountability. From the lesson learned, bullying is rife in schools and at home. This is manifested in different forms. Sometimes some children are coming in domestic violence homes, and sometimes also children themselves, they bully each other. We also discovered that we need to understand different forms of abuse, the signs and symptoms, and also to name them so that we are able to handle different cases when abuses happen in schools. We discovered that corporal punishment still exists in Zimbabwe. In this, when I talk about corporal punishment, I mean the beating of children during lessons in schools and at home. We needed to respond to address the issues learned through the curriculum. That's why we engaged the Minister of Education, and we got 30 minutes for each week for the lessons. We developed safe schools structures. We also promoted capacity building for teachers and school management. This was a whole school approach, which meant everyone was supposed to be participating. And because of that, we discovered that we needed evidence-based research. which would inform us through the theory of change. Hence, we partnered with the London School of Hygiene and Tropical Medicines. We had an implementation plan. Our first step was to select 42 schools. And right now, this implementation plan will be talked more by my friend who is going to continue with the lesson. And these 42 schools, we have what we call control schools and treatment schools. That will be done by the research. Then the research component are going to work with us as they carry out their baseline. And from the baseline, they are going also to, we have third level, where ourselves, we are going to train all those who are going to participate in the research work. And then lastly, our randomized control trial will be tested in the classroom. We have prepared learners' handbooks and also teachers' facilitating books. The purpose for intervention in safeguarding is very important because we want in safeguarding to reduce violence against children in schools. We would like also that the work we are doing at the Bishops' Conference can be shared by everyone across Zimbabwe. We are looking forward that the learning results can be shared also with others who are doing safeguarding in schools to reduce violence so that we generate a strong intervention model. Also, we are preparing that the work we are doing in our intervention, the trainings which we are doing, can help other people, not only in Zimbabwe, but those who are interested in intervention and safeguarding beyond Zimbabwe. In our intervention implementation plan, we discovered that we have 3 drivers which are very crucial. We need proper communication. Like we have so many partners, so many players in our work. So we need to communicate maybe on a daily basis and using other means of communication so that we are all moving in the same direction. We need coordination, and in our work we have done so far, we had coordination using the virtual meetings and also coordination having other meetings as teams, those who are participating. I will soon be showing you the participants. We need collaboration, working together, and also learning from others who are doing similar work, like other organizations. In Zimbabwe, in our safeguarding program, we have the following players and partners. We have the Zimbabwe Catholic Bishops' Conference. We have Q Partnership. These are specialists in research at local level. We have Childline. In case we have cases during our intervention, Childline will step in and respond to those cases. We have Porticas, who are our funding partner and also collaborating with us in our all activities. We have academic research teams, committees. We have London School of Hygiene and Tropical Medicine. We have the government itself allowing us some time to work together. So intervention, you are not working alone. You are supposed to work with others. And you have to collaborate and to unite, to agree on what you are doing. Otherwise, at the end of the day, we have no results. The following are the prayers which I have just highlighted. It is important for us to engage with other players because of the mandate which you are supposed to do in research. Some prayers are there to carry out the research. Others are for the curriculum. Others are there also for the ethical approval, which we ask when we are carrying out research. So an intervention with that, without proper preparation, won't survive. Our intervention strategy is a whole school approach with 3 phases. Phase 1, we are getting started. You have to know how we are preparing for the manuals, the mapping, and also for all the services which are supposed to be provided. Phase 2, we are creating our safe schools where all who are involved are supposed to focus and establish safeguarding structures, deliver the curriculum, and also continue with ongoing formation through trainings, skills building, and also through monitoring and evaluation, and also involving the community. Phase 3, we are working on sustaining our work, where we are going to focus on greater ownership and sustainability and celebrating our achievements in safeguarding. The strategy is a continuous process because we are dealing with a human development. What we want in the classroom and in the school is the whole child development. So it's ongoing monitoring, learning, and evaluation. We have 4 steps in our strategies: skills building and training and implementation of teams. Then we have curriculum-based activity with learners and parents. Then number 3, we have establishing structures within schools. Then number 4, we have school-wide and community mobilization. So when we talk about safe schools and the strategy, we are trying to highlight, we are trying to address the topics in our manuals are the ones which are going to highlight and address this so that when the research team comes, they're able to measure from the quantitative approach and also the qualitative approach. And when they are doing that, the research team, they're able also to use tools which will be able for them to know what was done in the curriculum and test the curriculum. From our strategy, we had been testing also our curriculum and what we have been doing and reviewing what was missing. So I'm going to invite my friend to go into detail about research. Thank you.
So a lot of my work is focused actually on school-based violence, which is how I got in touch with Sister in the first place. And now I've realized, Sister, it has been almost 6 years now that we've been collaborating. So it's been a long and interesting journey together. And one of the things I really value in my work is this close partnership between research and practice, which someone earlier was saying how important that is, and that should be more common, and I completely agree. So I would describe our relationship as a critical friendship. So I think we've been kind of walking along this process for the past 6 years together with a common goal, but with an open dialogue and able to give each other that kind of critical feedback. Yay, there I am. Okay. So Sisters described a lot about our broader research collaboration, which is focused around development and testing of your program, or intervention as we call it in my world, to prevent violence and improve children's outcomes at schools. So I'm going to focus in on a little narrow slice, a little piece of research that we've done under this broader collaboration today. And that is thinking about how adults in school settings in Zimbabwe, how do they actually conceptualize and how do they enact child protection in their schools? And I just want to acknowledge that I'm presenting this on behalf of a very large team of people and partners, and in particular my colleague, Dr. Ellen Turner, who actually led this qualitative work. And she couldn't be here today, so instead you've got me. Okay, so to start with, I just want to zoom us out a little bit and think about child protection in schools and why schools are an important space. And I really, I thought your comments and slide this morning, Professor George, about the levels that we can act through for different prevention strategies are really important. So there's institutional prevention. There's more in the sort of the medium level, I think you termed it, around schools, and then individual level work. And I think we need all of these ingredients in our prevention strategies. So schools, I think, are really important when we're thinking about preventing violence against children generally. And that's because globally, 90% of children at least enroll in a primary school. And we all know this varies a bit country to country, but if you're trying to reach children, almost all of them are at least passing through a primary school at some stage. Unfortunately, a lot of children do not experience their primary school as a safe space. So these overlapping circles are from UNESCO's typology of school-related gender-based violence, which is a bit of a mouthful. But it illustrates some of the different forms of violence that children experience in and around schools, whether it's psychological, physical, or sexual violence, and also that experiences of these different forms of violence overlap. So the children who experience one are also more likely to experience other forms of violence. And statistically, we've got reasonably good data on levels of physical and emotional violence that children experience from peers. And we know levels are really high. So 60% of kids will experience physical or emotional violence from a peer. We know that kids also experience physical violence from teachers and sexual violence from teachers and peers. But I have to say, from an epidemiological perspective, the data on the latter two forms of violence are not very good. But what we know indicates that violence is a big problem in schools. Okay, so I guess in my public health view, there's a clear need for us to be doing our child protection and safeguarding work in schools. And there's also a really, great opportunity to have a really big impact. So in the context of our work together in Zimbabwe, as we were sort of thinking about the development of sisters' intervention and work, we thought, okay, what do adults in the Zimbabwean school context actually understand by child protection? What are their experiences of actually trying to do child protection in this context? And then we also looked a little bit at how the structural context in Zimbabwe might affect this. And I think we've heard this at this conference time and time again, the importance of culture and different places having different contextual realities. Okay, so this is just an overview of our larger study together, which has now been going for quite some time. So the overall study is called the Safe Schools Study, and we've been doing development work. Sister talked a bit about some piloting that's taken place, and we're now on the cusp of starting a formal randomized controlled trial to see if the program is effective, okay? So this work today is focused more in the development and formative phases of our overall process. So to answer our questions about how people understand child protection, we selected 2 schools. So one was in a rural area, one in an urban area, both within the Archdiocese of Harare. The rural community People mainly did subsistence farming, and it was also near a mining area, so teachers and parents and children all worked in the mines periodically. In the urban area, the school was in quite a high-density area, and people mainly did street vending to earn money. And so when we did this research, you can see from our timeline, we've been going for a long time, so of course we had to deal with the COVID disruption in the middle of everything. So the time when we did this was just following the kind of first big set of school closures after COVID-19. And at this time, schools had just reopened. Teachers were going on strike over low pay, so morale and motivation were generally low. And adults in both the schools had been very concerned about what they perceived as a rise in drug and alcohol abuse and teenage pregnancy among the children during the COVID lockdowns. And it's also worth noting that at both schools, the school priests attached to the schools had both received training on child protection and had established a child protection committee. Okay? So what we did was some semi-structured interviews, and we spoke to teachers, to parents, to a couple of school priests and head teachers, and then various kind of higher level actors in the local education system, okay? And so there's a lot of data that came out of that, but I'm gonna share with you kind of 4 main things that we took away that helped us kind of shape and refine the intervention that Sister and colleagues have been working on. So the first finding is really around the context. And in Zimbabwe, especially at that time, the context was extremely challenging for teachers. They were burnt out. They were either not getting paid at all or not getting paid enough. And really were generally feeling not motivated and having a really high workload. And all of this, of course, affected their willingness to participate in child protection activities, which often individual teachers didn't see as core to their role. They thought, this is an extra thing and I can't take on anything extra. So a school priest summed this up. He said, our teachers are quite distraught with the employer, that is the government. So levels of motivation, enthusiasm, and energy are at their lowest. And these are the key people who are taking care of and teaching the kids. Okay? So really difficult context where teachers, who we are expecting to do this child protection work, are struggling. Okay. So the second thing that came out of that research was around how adults understood child protection. And their views were of child protection as quite a holistic concept. So holistic support for children's well-being and development. So a female teacher said, child protection is that these children need to be guided at home, at school, and community so that they live happily and safely. Okay. So violence prevention, although it might be my central focus when I think of child protection, was not people's central focus when we spoke to them, although it was there. So a male teacher, for example, he said, child protection means that we're protecting the child from any physical and emotional harm, and we want the learning environment to be free from violence. And what we saw kind of throughout people's accounts was a lot of emphasis on children's discipline and children's management of their own behavior. And this was really seen as the main mechanism to create self-sufficient children who could protect themselves, okay? So one of the education actors said, a child protection program at school should aim to create a learner who can take care of himself, who should be free to operate under any situation. That kind of learner is the child that we want to create. Someone who is self-sufficient in terms of creativity, someone who should be empowered in terms of decision-making. Okay, so a lot of emphasis on the child as the active agent in their own protection. We also found that at times the adults that we spoke to could blame and stigmatize children for the abuse that they experienced. So one of the priests said lockdown might also have caused some economic challenges in some families, and in those families, children might have exposed themselves to abuse for survival. In idleness, the children might have started indulging in destructive and abusive lifestyles because they were idle, not going to school, and not doing anything. Having overstayed at home, they are now exposing themselves to abuse. We can also see in our data that this blame and stigma was very often gendered, with a focus on girls being held more responsible. So a male teacher said, "The world they are living in is now bad. Even the elders, they tend to tamper or to play around with those little kids, maybe because of hunger or something. When a child, or maybe a girl child, starts to meet a sugar daddy, she may be tempted because of hunger, so they need to be guided always." So the last finding that I wanted to leave you with was just around adults' experiences of actually trying to report abuse and refer cases to the child protection system. So there were many challenges involved in this, and I think the adult actors perceived these generally as ineffective, and at worst as sometimes unsafe for children and actively harmful. So a female teacher who actually talked at length about her experience of trying to accompany a child who had a case. She said, "I think the main worry is that when a child is being abused, usually nothing will come out due to corruption. I remember one time there was a child who was abused. The teacher asked me to talk to the child, so I became friendly to the child. We talked about it time and time again until she revealed she was sexually abused. We went through child protection and justice, and the case was held at a certain magistrate's court. Nothing came out of this." A school priest as well talked about this. He said, "There might be some untouchables in the community or in the family. You can't report your own. You can't report those from the chief's family. The way cases are treated, if it's at a village court, they might not treat the cases sufficiently and professionally. They might not help the child." So in general, not good experiences of trying to get external help. Okay, so to summarize, I think what we found in this research was that the adults in the school context placed a lot of responsibility on children to protect themselves, and often had very high expectations of children's capacity to actually protect themselves. Children were sometimes blamed and stigmatized for the abuse that they'd experienced, and this was gendered. And the adults in general had a very poor experience of child protection system responses, and those were seen as largely ineffective. Okay, so I know this all sounds probably quite depressing, but the reason why we did this was to understand exactly the context in which Sisters' work was taking place and to understand what we could do within this intervention to help address some of these things. So I think the main things that we took away for our intervention, which are probably, hopefully also helpful to others, were the importance of addressing teachers' well-being. And we also, I should back up and say that Sister has done an excellent job of really co-creating the intervention content through a long process with lots of colleagues and peers in Zimbabwe. And we decided after this that we needed to do a careful examination to make sure we weren't inadvertently reinforcing some stigma and blaming of children around the abuse that they experience, and to make sure that children were not being held responsible for the abuse that they experienced. And I think one of the very difficult things that we then had to consider was whether in the intervention we should actually encourage children to report abuse. And I think there's a lot of interest and enthusiasm for encouraging children to report. But from an ethical standpoint, if you are encouraging children to disclose their experiences to you, you've got to be able to respond appropriately to those disclosures in those cases. And what we're hearing in this context is that that is often not possible. So that meant we had to have a lot of discussions and rethink about how we would handle reports and the extent to which we wanted to encourage reporting in the intervention. Okay, so let me stop there. One more, just to say that the research that I've just outlined is published in that one on the left. So if anybody's interested in the kind of more detailed explanation, it's publicly available. You can just Google it. And I'll stop there. Thank you.
Thank you. Yes, and thank you for sharing your work and the outcomes, and also from a different cultural environment for many of us. And yes, and thank you for respecting the time despite the delay, so that we have a few minutes to make questions, if there are any, before we go ahead. So please.
Thank you so much to the two of you. I want to comment, it's not a question necessarily. I want to comment what you just said about the reporting. I've been having concerns with mandatory reporting in our context. My context is the same as the one in Zimbabwe. The assumption with mandatory reporting is that the legal system is working very well. It is accountable. It is able to respond properly to cases. Whilst in our cases, reporting means you are going to, because the child will go through all the investigation process properly as you know it, which is a re-victimization of the child. And then after the investigation, the pain that the child goes through, nothing happens. The child remains with the pain of the abuse, but not only the abuse now, but also of the investigation by the police officers who are asking the child, what were you wearing? Why were you there? Didn't you know? You know. So I commend that, and I think I like the way you say it. You are considering whether to encourage children to report or to assist children to process the pain of the abuse. I think that is the perfect response you can give, because mandatory reporting does not always work in all places. Thank you so much.
Yeah, thank you for that comment. Yeah, I think that's spot on, really. I think mandatory reporting is controversial for the reasons that you are discussing. There's an inbuilt assumption that it's good for the child, for the person that is being reported about, which don't always hold. Yeah.
Okay, thank you very much. My question comes to when you said the teachers are actually letting the children protect themselves. in that area. What I want to know is, from your research, what exactly are these teachers teaching these children in order for them to protect themselves? What kind of information are they giving to these children to protect themselves? Because I saw that maybe as an interesting area, if children can actually be taught something to protect themselves. So from your research, what exactly were they giving to these children?
Thank you very much. We have designed some manuals for teachers to guide children how to report, to identify cases, and also to identify danger. So it's not to say the children are going to protect themselves in safeguarding, but children are now aware of how they are supposed to act, and sometimes how they are supposed to take cases forward. That's why we are also encouraging them to have child-led committees where children can go and report to the other child and their case freely without any threat of an adult. Sometimes they fear the adults. So the children are given that space. So that is how they are protecting themselves also. And we encourage children when they go home to walk in groups so that they can also refrain from danger. So that is what we are trying to do, to give that awareness and also to empower them to be able to identify any dangers. Thank you.
Thank you. I'd like to build on that question. Given that you now know something about teachers' attitudes towards children, have you changed the intervention, the aspect of teacher training or the teacher manual? Have you changed that, knowing what you now know from that piece of research?
Thank you very much. Yes, from our previous manuals, we are emphasizing on the peaceful environment, but now we have shifted to look at teachers as the human beings, individuals who also need support themselves emotionally, as you have heard that, for example, their remunerations are very low. So as a human being, you are also faced with responsibilities. So emotionally, the teachers can be affected. So we have changed our approach on how we do teach emotional development. We are now reflecting, and we are changing attitude through practice. The teachers themselves, they undergo a training where they come in terms with their own emotional problems, and they are helped through counseling and other supporting mechanisms before they take the same topic to the students. Because sometimes you find the teacher has no space also even to cry out what is, maybe that teacher was also abused somehow, and you hear some teachers saying, I'm beating because I grew up being beaten. And then they will tell you very difficult stories. So we are giving them space also during their workshop, or even to have their teams in schools, teams for the teachers to have space to discuss. So we have changed the approach. We will share the manual with you when we have finished. It's still under print. Thank you.
Yes, thank you. My question has to do with this very unique link between London and Zimbabwe. As we look at this day, talking about the connection between researchers and practitioners, maybe you'd have some comments on the challenges simply between physical distance and what you've learned in making this collaboration. Thank you.
Thank you. That's a great question. And yeah, I think we were lucky that, I mean, this has been a long collaboration. Thanks to our donors, really. They've enabled us to kind of connect properly over a long period of time, and we're lucky that we started before COVID. So I think that was probably one of the most challenging periods for us. But I think having that connection and going slowly over a long period of time and this continual kind of feedback and learning together has been crucial. And there have been challenges, as you would expect, but I guess it feels to me like when, we meet, we discuss, we come together. Don't know, sister, what do you want to say about it?
Thank you very much. What we did, I know with COVID, we couldn't meet physically, but when the COVID was over, we were able to meet. London School came to Zimbabwe, and then they spent time with us. We went through a lot of information gap. For example, reviewing our theory of change, because before COVID we had a different approach, but after COVID, things had to change. And then we had to agree. And then from time to time, we have what we call Teams meeting on a monthly basis. And if there's anything urgent, we have it twice in a month. So we are still connected, even emails. So we are very, very connected on a daily basis. Thank you.
Okay, yeah.
Sorry.
Thank you for the presentation. My question, if you can comment, I didn't see in the picture about the collaboration, if you have some approach with the traditional leaders or chief community, because we can see from the last slide that there is it is difficult to report when abuse happens in this circle. So have you had some contact, approach, or working with traditional leaders of the community? Thank you.
Thank you very much. For the community, we have what we call adult-led committees. These adult-led committees are not coming from the school, they are coming from the community itself, and some professionals who are coming within the community. The traditional leaders, we engage them because of the issue of culture. We have a book which we have written, Culture as an Enabler or a Barrier. So we always engage the traditional leaders in our safeguarding. They are in the community. Sometimes they are also in the community. We engage the police force also. We engage the health department because there are some things which happen which we don't know ourselves from our discipline. We need these people to support us. The community, that's why in one of my slides, I said conscientization of the community. Community, I'm referring also to the community leaders. Thank you.
Sister, thank you for your presentation. I'm just thinking about our situation in the Philippines, that there is a kind of abuse that is now, prevalent in our country. And you know that we are hotspot on online sexual exploitation. So I'm just curious of how can you see or spot a red flag that a child in your school is a victim of online sexual exploitation by her parents? And do you have any intervention? And what do you do? Thank you.
Thank you. I go back to our trainings as well for the teachers and also for the children. How do we identify? That's why I talked about signs and symptoms of abuses. There are so many signs which you can tell that this child is being abused at home. And sometimes you find that child isolating themselves, or sometimes that child is always crying when they reach school, and sometimes the child doesn't want to go home. They want to remain in the school. So we have found ways and means of identifying such things, and then we make a follow-up. Thank you.
Okay, I think we have time for one more question, so please.
Yeah, thank you, sister, and dear sister there for the wonderful presentation. Actually, I did my internship in Zimbabwe, so the great work that you are doing there, I was able to feel it as I interviewed the priest. And my question is, judging from what you have presented, there is need, it is possible that if an abuse is happening from the family level, that is, a child is being abused, and then not able to really come out and speak out because of the challenges, the problems of, if I go now, supposing my father is being affected, if I go now to report my father, what is my fate? Am I going to go to school again? Am I going to eat? Am I going to dress? I mean, these are the challenges, and eventually my father is going to be imprisoned. So, is there anything that the government is doing to help a child, supposing a child is having this crisis, so that if the family is not there to help, then the government is there to help this child to grow? Is there anything that the government is doing? I'm talking about the collaboration where the government intervenes as a welfare scheme to help the child to come out of the struggle if at all a child is being abused by the parents.
Thank you. Yes, there's something happening because, like as I've highlighted already, I've also put the government there. The government is coming in the name of social welfare. There's a department for social welfare which deals with the children who are being abused at home and also those who are orphaned. There's something happening with the government. We are collaborating with the government. Even the Ministry of Education, we were discussing how best can we help students to continue with education if they are coming from abused families. So something is happening, but not a larger scale. We are also discussing that at church level to say how best can we create a fund to help these children, because it's now common. We're looking at what is happening in the country. Thank you.
Yes, please.
Just want to add one point on that. I think, a lot of places, we all know on paper, have great systems and great policy, but the challenges are in implementation. And I think, there are pockets of good practice and examples of where things are working well. But, we, as a global community, we don't have the capacity to respond to all of the cases that are out there. So for me, that really underlines the importance of primary prevention. If you look at the levels of violence and abuse that children are experiencing, we need to stop it before it starts and not be only focused on response.
So thank you very much, Sister Nyadombo and Professor De Vries, not only for sharing about how a collaboration between researchers and practitioners can work, but also between different cultures. So it's really a very inspiring example. So thank you very much. And so